Hello once again to another session of Dr. Barbara Miller's NCLEX, and as in Nancy, review, or the State Board of Nursing review. We are on endocrine system. Okay, so this is a disorder of the posterior pituitary gland, such as diabetes insipidus and syndrome of inappropriate secretion of the antidiuretic hormones. We'll compare and contrast. So with diabetes insipidus, it has nothing to do with diabetes mellitus. Okay, this is problems in the posterior pituitary gland. Okay, where the patient will hyposecretes. There's a deficiency of the antidiuretic hormone, okay, or vasopressin, due to a disorder of the posterior pituitary gland that results in the inability of the kidneys to conserve water appropriately. The diabetes insipidus is caused by head trauma. It could also be a tumor, surgery, radiation, central nervous system infections, a malignant tumor, okay, or failure of the renal tubules. The underlying cause of diabetes insipidus should be identified and treated. So what are the clinical manifestations of diabetes insipidus? The urine chemistry diluted. These patients will have over 4,000 cc's of urinary output per day. They have decrease in urine specific gravity, decrease in urine osmolality. The serum chemistry, they have hypernatremia. Their sodium levels goes up, so they hold on to sodium. They have increased serum osmolality. They have polyuria, excessive urine, and polydipsia. Okay, so polyuria, urinary increase in the urinary output, as mentioned before, over 4,000 milliliters of urine per day. Okay, clients may crave ice in excessive amount. They become dehydrated. They have weight loss, muscle weakness, and dry skin. They are hemoconcentration. So what are the diagnostic procedure? Water fluid deprivation test. So you want to monitor the body weight, vital signs, hourly urine output, vasopressin test. Perform only if the fluid deprivation test is inconclusive. IV vasopressin is administered. The client urine and serum chemistry will improve. They also will do MRIs of the hypothalamus and the pituitary and a 24-hour urine collection. They also need collaborative care. So the nursing intervention, what the nurse needs to do, weigh client daily, monitor urine output and urine specific gravity. Okay? Also, you want to monitor the patient for blood pressure, rather. Sorry about that. Okay, monitor the blood pressures and heart rate and maintain fluid and electrolyte balance. You want to monitor the specific gravity. Medication for diabetes insipidus is that of desmopressin acetate. Desmopressin acetate, vasopressin. If the diabetes insipidus is nephrogenic in original, thiazide diuretics will be prescribed. You want to educate the client and refer them. This is a lifetime vasopressin replacement therapy. Report weight gain or loss, polyuria or polydysphia, okay, to the provider, and monitor fluid intake and urine output. And avoid foods with diuretic actions. Okay? In contrast, syndrome of inappropriate secretion of antidiuretic hormone is on the opposite. It's excessive release of antidiuretic hormone resulting in the inability to excrete appropriate amount of urine, this developing fluid retention and dilutional hyponatremia. So SIADH, they do have low sodium, hyponatremia, caused by neoplastic tumor, okay, head injury, meningitis, respiratory disorders, and some medication. For example, vincristine. Vincristine is a cancer medication. Phenothiazine, tricyclic antidepressants, thiazide diuretics, and nicotine. So what are the clinical manifestations of SIADH? Urine chemistry, very concentrated. Increase in urine specific gravity and osmolality. Serum chemistry dilute, so they have problem with the sodium, hyponatremia, less than 135. Remember, the normal sodium is 135 to 145. Decrease in serum osmolality, mental confusion, okay? You gotta observe for seizure activities, okay, due to hyponatremia, weaknesses, anorexia, nauseousness, and vomiting due to hyponatremia, increase in ADH, vasopressin levels, and weight gain. These patients will need collaborative care, okay? So nursing intervention, restrict oral fluid to 500 to 1,000 cc's per day. You want to monitor their intake and output. You want to weigh client daily, monitor for increased blood pressures, tachycardia, hypothermia. You want to also monitor their mental status, frequently initiate seizure precaution due to hyponatremia. What are the medications for SIADH? Hypertonic saline, 3 to 5% sodium chloride, loop diuretics. What are loop diuretics? Furosemide, Lasix, okay, to treat hypovolemic hyponatremia, and also demeclocycline. I know I batched that, but D is in David, E is in Edwards, M is in Mary, E is in Edwards, C is in Charles, L is in Larry, O is in Orange, C is in Charles, Y is in Year, C is in Charles, L is in Larry, I is in Image, N is in Nancy, E is in Edwards. Vasopressin receptor antagonists conivaptan, and their therapeutic measure treat the underlying cause, which is surgery, chemotherapy, and radiation. Thank you so much for watching this video on the conditions of diabetes insipidus versus syndrome of inappropriate antidiuretic hormone. Please like, share, and subscribe to the channel to help it grow.